Once your patient has been properly checked into Whiteboard, we can then start scheduling treatments, and we're going to go off the hospitalized patient plan. The initial hospitalized patient plan is always going to be found underneath the medical condition in your check-in section of your Avamark. So I'm going to go to the right-hand side of my screen, click the medical condition, and it will open up. And then I'm going to scroll down to the plan. As you can see here, I already have it filled out, but if you didn't have one yet, you would just right-click, view glossary, and you would search hospital, plan, I'm sure, patient, whichever you prefer, and you would click on it, and then that would be your template to go from. So Dr. Ryan had put this one in, and for the diet amount and instructions, he would like 1.5 cans of EN twice a day. For the water, it's going to be free choice water, which is what FC stands for, so he can have as much water as he would like. Then we have the doctor's initials, nurse's initials. If the patient was on fluid therapy, this is where we would fill out this section. Usually it's LRS fluids, but if it is sodium chloride, you would obviously change that. You're also going to want to put your catheter date in here. And always remember, if you are doing a replacement catheter, make sure to change this catheter date on the most recent hospitalized patient plan so that anyone looking on the record would know when it was put in, because we can never have a catheter be in for more than 3 days at a time. Then your rate would go right here, and then what type of maintenance is it? Is it 1, 1.5, 2? You'll put that there as well. The actual medications that we are going to give will be underneath. As you see, for the first medications, it's going to be metronidazole, and it's going to be 500 milligrams. The frequency is how often we need to give it. Since it's twice a day, it's going to be every 12 hours, as it's always scheduled as in an hour interval. And then the rate is the amount. So Good Dog will need 1 tablet twice a day, and it's the 500 milligram metro. The route is where it's going to go. PO is by mouth, and it's going to start at 10 p.m. tonight. And then we have Cerenia. This is a anti-nausea injection. It's a once-a-day medication, which is why the hour interval is 24. The rate is the amount of inventory we're going to pull up, so it's going to be 2.5 mils. And then the route is going to be subcutaneously, and we're also going to start that tonight at 10. And then as you can see under that, it says weight and vitals every 24 hours. That's because every single patient that is in the hospital should have this checked every morning, and we always schedule that at 6 a.m. Then if there's any other special instructions under there, you can always add it. For this patient in particular, we want to monitor for diarrhea every 3 hours. And now that we have the patient plan filled out, we can then use this to reflect our whiteboard treatments.